We welcome you to our module Seizure Disorders and Convulsions, HCC 85 from MRA Tips. This module has been developed specifically for MRA reviewers as a refresher on diagnosis criteria, documentation, and coding of seizure disorders and convulsions. At the end of this module, the learner will be able to describe seizure disorders and their cause, discuss the criteria for the documentation of seizure disorders, identify the ICD-10 codes that fall under seizure disorders and convulsions, review the example of the assessment and plan for the disease, identify the exceptions to keep in mind while coding for seizure disorders. A seizure is defined as an abnormal electrical discharge in the brain caused by a clearly identifiable external factors that may be resolved or reversed. Normal brain function requires a coherent, organized and a coordinated discharge of electrical impulses. They enable the brain to communicate with the spinal cord, nerves and various muscles of the body. When this electrical activity is disrupted, seizures occur. Seizures can cause muscle spasms, limb twitches, and loss of consciousness. They are most common for children below 2 years old and adults over 60 years of age. There are various causes of seizures. It can occur due to previous brain injury, a history of stroke, brain tumor, Alzheimer's, lupus, meningitis and certain recreational drugs. A seizure disorder, on the other hand, is a chronic brain disorder characterized by recurrent seizures on more than one occasion that are not provoked by a clearly identifiable external factor. When a person has 2 or more unprovoked seizures, he or she is considered to have epilepsy. According to the Centers for Disease Control and Prevention, around 3.4 million Americans are affected by epilepsy, which is about 1.2% of the entire population. Epilepsy can affect people in different ways, as people experience seizures in different ways. Some seizures can cause a person to collapse, shake or get convulsions, while some can cause a staring spell. Although in most cases, a person will tend to have the same types of seizures each time, hence the symptoms are similar and episodic. The criteria for the diagnosis of seizures requires a confirmed diagnosis from a specialist consultation, usually a neurosurgeon, medications for seizure and epilepsy, and an electroencephalogram test. EEG is used to determine problems related to the electrical activity of the brain. The documentation should clearly identify the type of seizure, whether the person has had history of seizure, and the frequency. If the seizure is recurrent, it is diagnosed as epilepsy. When the seizures fail to come under control with treatment, it is called intractable. Let's look at the ICD-10 codes that fall under seizures. For unspecified epilepsy, which is not intractable, with a status as epilepticus, the ICD code is G40.901 and the HCC is 79. For unspecified epilepsy, which is not intractable, without epilepticus as the status, the code is G40.909 and the HCC is 79. There are many sub-entries under this code termed not elsewhere specified or NOS. NOS is used when there is a deficiency in documentation prevents you from coding to a higher level of specificity. Epilepsy NOS, epileptic convulsions NOS, epileptic fits NOS, epileptic seizures NOS. Recurrent seizures NOS, and seizure disorder NOS come under non-intractable unspecified epilepsy without epilepticus as the status. For unspecified epilepsy, which is intractable, with a status as epilepticus, the ICD code is G40.911, and the HCC is 79. For unspecified epilepsy, which is intractable, without the status as epilepticus, the ICD code is G40.919, HCC 79. And lastly, for unspecified convulsions, the code is R56.9. Note that it doesn't belong to any HCC category. The assessment and plan should address the diagnosis and include 2 support indicators. Let's see an example of a progress note for seizures. Patient name: Victoria Lawrence. Date of service: September 19, 2019. Date of birth: May 28, 1986. Assessment and plan: seizure disorder. Continue to monitor. Patient to continue with valproic acid 500 mg QD. Patient was referred to continue with neurologist. Follow up in 4 months. Exception: the codes listed in the series G40 till G40.919 where epilepsy is diagnosed with multiple seizures have and excludes one note for the following. F44.5 Conversion disorder with seizures. R56.1 Post-traumatic seizures. R56.9 Convulsions nose. R56.9 Seizure, convulsive, nose. And excludes one note indicates that a coder should never use the excluded code with the code above the excludes one note. The two conditions cannot occur together. We have reached the end of our short refresher course on seizure disorders and convulsions. We gave you a short introduction to the disease, reviewed the criteria for the documentation of seizure, identified the specific codes and HCC category pertaining to the disease, and finally discussed the exceptions which are to be kept in mind while coding for seizures. Thank you for joining us.